So now we're going to consider some ways that we can work on our knee range of motion. If it's limited, if it feels tight, some of these things may be good if we have some swelling in there just to kind of help pump out some swelling and get that knee just moving better after an injury or after a tissue strain, and things that we can do anywhere with little to no equipment. The first thing that we're going to take a look at is knee extension. So several different ways that we can do this. If someone's lacking knee extension, oftentimes you'll kind of see them with a little bit of a knee flex position. When they go to walk, they just don't extend through that knee and it kind of stays more flexed. And they don't really get that full elongation to allow for better push off and propulsion forward. So something that we can do in standing is um, a combination of extension with rotation. Now, I suggest this because sometimes, depending on what's going on, if we just try to take a bent knee and just try to push it straight back into extension, we may cause some impingement and some irritation. When the knee goes into extension, there's a little bit of rotation that takes place between the thigh bone and the shin bone. And so to help facilitate that, what we can do is in a neutral stance, we're just going to rotate towards the side of the knee that we're working on while we extend. So in this case, my right leg, I'm trying to get it out of a little bit of a bent position and working on straightening. So I'm going to rotate my hips to the right. And as I'm doing so, I'm just going to push the back of my knee back. So I'm helping guide that rotational component into my extension. And then I'm coming back out of it. I rotate and extend, and then I come back out of it. And I've just found with people that this seems to be a little bit more fluid. That rotation helps feed better extension, and usually is a little bit less pinchy versus just going straight into extension. It also still allows us to use our quad muscle to kind of help facilitate that straightening. Working on this stuff in a standing position is nice because depending on sensitivity, sometimes standing on our leg, it's going to be more prepped and more comfortable with working on range of motion. So yeah, this is a technique that um, is kind of, it helps with that extension, but seems a little bit less aggressive. So again, we rotate to that side as we push that knee back a little bit. Now from here, we can kind of start to play with our foot positioning. So again, we get ourselves into a position that kind of looks like walking. So I may bring my left foot forward slightly. So now that right foot is back as if it's getting ready for push off when I'm going to step. And I can do the exact same thing. I'm going to go ahead and rotate to that side and push that knee back and then come back out of it. I'm going to rotate and push back and then return. So working on extension and standing. Now the next thing is we're going to take a look at flexion, but more in a ground level positioning. Now from here, I've found where working on knee bending oftentimes doesn't feel great in a loaded position or a standing position. And so whether it's sitting or on a bed or a floor and then having something that can help assist or limit the friction of the bending motion seems helpful. I'm going to use a foam roller to help facilitate the bending motion, but for yourself, it could be an exercise ball, it could be a basketball or a volleyball, just something where you feel like your foot is stable and it can kind of roll with you as you're moving back and forth. And so when we're in this position, we can work on our heel slides where we just kind of glide back towards us, bend the knee, and then return. And so just like I was mentioning with extension, with flexion, there has to be a rotational component or availability also. Otherwise, the knee's going to impinge on itself and get stressed. And so something that we can do is after we use a couple just straight pulls back and forth, maybe we do 5 or 6 of these. And then after that, your second go around is going to be a little bit of a toed in position, going through knee flexion and then out to extension. So by causing or creating that little bit of tibial rotation, we're getting a little bit of a different stretch into the connective tissue around that knee. And then we can go ahead and After 5 or 6 of those, we rotate out. Now we get a little bit of a different stretch to the opposite side of the connective tissue and the knee joint. Working through that, again, a great way to work on kind of stretching tissue, yes, but most likely what we're needing is a fluid change. So by getting the joint surfaces to glide, pivot, and move around, our muscles to contract a little bit, what we're doing is creating a fluid change of the tissue around the knee as well as the fluid inside the knee that helps to nourish it and keeps it lubricated. So now from here, what we're going to do is we're going to transition into ways that we can start thinking about strengthening of the knee specifically.